Good evening, everyone. I hope you can all hear me. This is my second live stream, and I've called this one Spirit Headache because I'm going to be talking about migraine. And thanks, Tash, for the idea. Hello, from your comments on the video last week. I just thought maybe let's do an episode on migraine. So I'm going to keep it short again this time, try and keep it to 10 to 15 minutes. So I just want to start by saying that the title of this video, Spirit Headache, is for a couple of reasons. Firstly, I was thinking of there's a very ancient practice of trepanation where they used to literally drill holes into people's heads to let out the bad spirits or to simply relieve the feeling of pressure that can accompany a migraine. Apparently didn't have a great survival rate. Not the best treatment, by the way. But also there's a famous migraineur in history, Hildegard of Bingen, the German nun and abbess and herbalist, very famous lady. And it's thought now that she maybe suffered from, she was very famous for having visions, and it's thought that at least some of her visions, the descriptions she gave them of the colors and whatnot, sound like this phenomenon in migraine called visual scotoma, which is the visual disturbance that can appear, doesn't always, can appear with some types of migraine and often precedes the actual pain of the headache. And sometimes there's loads of different kinds of migraine, but some types you can just get the visual scotoma without the pain. Others you can have the pain without the visual scotoma. There's abdominal migraines, which aren't even in the head. There's loads of different varieties. I have put a link to a good general web page about migraines in the description box below this video on YouTube if anyone's curious about different types of migraine. But really, I just wanted to spend a bit of time on some of the different herbal responses or thoughts that I might have as a herbalist if somebody's presenting with migraine. Now, obviously, everything I say in this video, you can look into these things yourself, but nothing I'm saying online in this context is to be taken as a prescription. If you're on any prescription drugs, don't stop taking them without seeking medical advice, and please seek a medical herbalist to get a proper prescription from if you want to be treated for migraine. So this is just for general information, the usual, the increasingly important YouTube disclaimer. So all right, so migraine, I'm just going to start with this book may be familiar to some of you. Certainly when I used to work in Neal's Yard, we used to refer to this all the time. It's Thomas Bartram's Encyclopedia of Herbal Medicine. And it's definitely got its flaws. I think it's a wonderful little reference book, mainly for generating ideas. I mean, it was about 50 years old now, so it's not exactly up to the minute, but it's got lots of little ideas. So what he says about migraine, and I'll try to sort of fill in any flaws or things that I think maybe need correcting. So recurring headache commencing with constriction of blood vessels of the brain, followed by expansion, which allows engorgement of vessels. Single or double-sided, he means sides of the head, with nausea, vomiting, speech difficulties, visual disturbances, emotional stress, and tension. Half of all migraine patients suffer from anxiety, and 1 in 5 experiences depression, according to a study carried out in Manchester University. Causes, many and varied: alcohol, excess coffee and caffeine stimulants, gluten food allergies, dairy products, chocolate, citrus fruits, related to carbohydrate metabolism, may be associated with menstruation or emotional disturbance, nervous or physical fatigue, liver, stomach or kidney disturbance, or the pill. All right, there are a lot of unproven associations in there, but there are some ones that are a bit more solid. So for example, the association with menstruation, that is correct in that migraine is, I think, about 5 times more common in females to males, and it most commonly occurs, I think, between the ages of 15 and mid 50s. So obviously there's a tie-in with increased hormonal activity, sort of reproductive hormones during that time. The pill, I think there's a link there. The causes, I wouldn't say any of those foods are causes, but they certainly can be triggers. Some of the things he mentions there for some people. What's interesting to me is that the chocolate that he mentions, when they've actually tested that, it doesn't actually appear to be a trigger at all. Some people are absolutely certain that chocolate is a trigger, but when you've actually looked at it like statistically, tested it, it doesn't appear to be. But that's interesting to me because chocolate, or cacao more specifically, is very high in tyramine, an amino acid which can be a headache trigger. And you find tyramine in red wine and some other fermented foods like hard cheeses. Caffeine's an interesting one too, because caffeine can actually relieve migraine sometimes if taken at an early stage, because it constricts blood vessels and reduces pain. But caffeine withdrawal can certainly trigger general headaches and sometimes migraines. And sometimes caffeine, probably because of its slightly pressor effect, its stimulant effects, might, by just inducing a bit of stress, trigger a headache. Other things he says there: the recurring headache commencing with constriction of blood vessels of the brain. That is true, but it's now thought that they used to think that was the cause, and now they don't. That more recent research has shown that constriction of the blood vessels in the head that can occur with migraine can be separate from the pain. They used to think it was the constriction and then dilation of blood vessels followed by pain. Well, they've now shown that the pain can precede that or occur independently of that. So that's interesting. It may be linked, but it's not causative. It's not a causative phenomenon. And there are lots of different theories about the etiology, the cause of migraine, but basically they don't know. There's loads of theories. There's this sort of spreading wave of changed electrical impulses, which analogous perhaps to epilepsy, but very different. There's changes in the sort of serotonergic, the transmission of serotonin in the head. All of this is very mechanistic, very modern medicine, very useful, but we still don't have precise mechanisms for that. The practical side of it to me is that we have herbs. So Bartram, as usual, lists a whole bunch of plants, which I'm not going to go through. You can check out it's a useful little herbal reference book, his Encyclopedia of Herbal Medicine. But I am going to refer to one of the most common ones, which is feverfew. And I have put a link to a recent meta-analysis where they pulled together loads of clinical trials of feverfew or tanacetum parthenium in the description box. So if you want to check out that paper, you can do. Basically, the trial was like, it seems like that all the data looked at together, it seems like it's probably effective, but we need more data, which is typical. But a couple of things to say. Firstly, feverfew is an amazing little plant. It was traditionally in the Middle Ages regarded as a herb of Venus, which means they thought of it as something which would be more useful for gynecological conditions, so for women's things. So that would be, I think, suppressed menstruation, painful menstruation. It was an emmenagogue, meaning it increased bleeding and it reduced inflammation or pain. It reduced cramps. But they also thought of it as something which generally reduced inflammation and pain, and sort of palliated inflammatory states. And it does that. We know that there's loads of compounds in feverfew, tanacetum, parthenium, and there are a few very researched compounds in particular, one called parthenolide, which is anti-inflammatory by a couple of different mechanisms. So, and the trials show that there does seem to be some efficacy for migraine, but it's not super consistent. It's a very safe plant. The only side effects I know of for feverfew are it can sometimes cause minor mouth ulcers, aphthous ulcers in some people. And its other side effect is it is antidepressant because it increases serotonin levels. So there might be a theoretical contraindication with other pharmaceutical antidepressants, although I haven't seen that and that has not been reported. But I would urge caution to anyone who's taking a standard antidepressant. It might not be the right thing you might not be good to stack them, hypothetically. Of course, the thing is, and I've had this objection in the comments of my videos before when I'm talking about all this scientific research and the modern uses of herbs weren't traditionally used this way. And of course, I know that. And as a herbalist, I don't really prescribe like this. I don't prescribe like, you have migraine, therefore you take feverfew. I mean, I just think it's a good thing on a primary care level to reach for over the counter. If you have migraines, it's a good pretty harmless thing. You can check it out. If you're on tablets, you can check with the pharmacist, see if it's safe for you to take, and try it. And there's very little risk in doing so. So it's a good frontline thing. But in fact, there are loads of different plants you could use. And as a herbalist, I would often try to work out what might be underlying the headaches. Now, we don't know what the physical cause is, as I've said. So there would be I would really be looking for patterns of dysfunction. So one of the herbs that I love, and I'll mention briefly, I will come back to it in future videos because it's one of my favorite plants, is wood betony, or Starkis officinalis, which was used traditionally, among many other things, for recurrent complaints of the head, particularly head pain. And it was said to gently heat the head. And one of the notable things in migraine is, even though the sensation in the head can be really hot, is people can go really pale with migraines. It's a sort of leaden color to the face, and that's a good traditional indication for betony. And betony wouldn't usually be used, same as feverfew, not really used to cut a migraine if it's starting. More you sort of use it long term over a period of time. Some of the other conditions that betony might have been good for were a sort of tendency to asthma, heartburn or reflux, in wounds internally. So I'm thinking like a tendency to herniation, that kind of thing, maybe hiatus hernia, reading between the lines of some of the old texts, which suggest reflux. Also, any sort of chronic neuralgic pain, particularly in the face or head. What else? Sinusitis, sort of any sort of phlegmy conditions involving sort of phlegm in the head and excess, slightly allergic-y, but I tend to think of it, and this may be completely wrong, because all of these indications are derived from old herbals. None of them have, the mechanisms haven't been researched. And it's the genus to which wood betony belongs, Starkis, is a fascinating genus. And I have put a link to a paper investigating the pharmacology of different Starkis plants and species in the description box for any pharma geeks who want to check that out, because there's so many different compounds in this genus. And wood betony was, in medieval times, the medieval panacea. They used to use it for everything. Not quite everything, but lots of stuff. And so, which means it really is a herb deserving of further research. But reading between the lines, I tend to think of wood betony as an autonomic nervous system readjuster, bearing in mind that is entirely my categorization or conceptualization of its action. I have no proof of that. This is simply based on how it appears to act, in that when there's some sort of hyperactivity of either the sympathetic or the parasympathetic, and I'm not talking extreme, I'm not talking like you've just had an EpiPen or something. I'm talking like there's an extreme, there's a mild deviation or dysfunction, as you often find in the sort of the asthma with reflux, for example, where you've got this hyper parasympathetic response going on. Something like betony can really, over time, gradually calm that down. It's a really interesting plant, or at least it seems to work that way. So that's betony. And with reference to the title of this video, Spirit Headache, betony was seen as a herb in medieval medicine of Jupiter in Aries. Jupiter, the planet symbolizing sort of the greater benefic, like gentle things which bring benefit. And most of the plants which were assigned to Jupiter in medieval medicine were food grade, pretty innocuous, very gentle, very broad and general in their action, the kind of thing that is not usually turned into a drug by the pharmaceutical industry, because when they go fishing, they often can't find one compound that does the job. There are a few notable exceptions, but even there, like I'm thinking of milk thistle with silimarin, that is a complex, it's more than one flavonoid extracted from milk thistle, which was a herb of Jupiter traditionally, and they extract the complex, the mixture of those flavonolignans, I think they are, that protect against liver damage, and they use very specifically for some forms of liver damage, like that caused by Amanita phalloides, death cap destroying angel mushrooms, which destroy the liver, and the milk thistle lignans protect the liver. Also, I think carbon tetrachloride poisoning. So pretty niche, but anyway, the point is that these herbs of Jupiter were very gentle and food grade, and it was Jupiter in Aries, which rules the head. So that gives you some idea of what it was about. And the other word, the other name for betony was bishop's wort, because it was grown in monasteries and it was seen to drive away or repel bad spirits. And then just a few final thoughts. I mean, just the Bartram talks about this sort of like the liver, the kidney could be having problems eliminating things. This is one of the sort of herbal hypotheses, broad strokes. Maybe the liver's having problem eliminating things, so you get a buildup of inflammatory rubbish. Ditto the kidneys, in which case if you support those organs, the migraines can go away. The other big deal, of course, and this is the other reason for the title of this video, Spirit Headache, is that it can be simply to do with your spirit. Like a lot of illnesses are on some level psychosomatic. Now, I'm not saying here that migraines are all in your head. It's all just get over it. It's fine. No, what I am saying is that we've all got our Achilles heel, the bit of our physiology, the bit of our system, which will flare up when we are chronically stressed. And I think migraines for some people, it's the central nervous system, it's the head. Now obviously that's a bit of a fluffy way of thinking of it. As I say, we could drill down and find specific mechanisms, hopefully not drill down in the very traditional sense of trepanning people. That's proven not to work, but I mean, we'll find out more mechanisms as time goes on, I'm sure. But I do think that idea of particularly with something like pain syndromes, it's almost always worth looking at where the chronic stress triggers are, and if the pattern of the headache follows or falls within any particular incidents in the life. The headaches could be triggered purely physically, as I say, if any, traditionally the concept would be if any organs were struggling, or if something had caused your general level of inflammation to increase. Perhaps we may one day discover that migraines follow on from infection by particular viruses. It turns out, as we learn more and more, that viruses seem to initiate lots of things that we'd not suspected that they did, good and bad, over time. But the point here is that I think there may be therapies, like, for example, I like rapid transformational therapy, which is completely unproven, but it's been set up by Marissa Peer, who's a hypnotherapist. And it's sort of like a combination of psychotherapy and hypnotherapy, where they sort of try and find out why a person has a particular set of symptoms. And it's not going to suit everybody, but for those who it does, it can be remarkably effective, because in some cases, if you can remove the underlying psychological stressor, then you just stop leaning on the button that triggers that disease. Anyway, that's enough from me today. I've gone on slightly longer than I wanted. I hope this has been enjoyable and useful to you. If it has, please like the video, please share it with anyone who you think might find it interesting, and please do subscribe. And hopefully I will see you next week. Bye.